Good day. I am Dr. Camencita Padilla, and I'm here to share the story of the Philippine Newborn Screening Program. What was the initiative taken? We were interested in setting up a national newborn screening program in my country. Newborn screening is a universally accepted public health program aimed at the early identification of infants who are affected by certain genetic, metabolic, or infectious conditions. It entails getting a few drops of blood from the heel of a baby, placed in a special filter card, and sent to the laboratory for testing. Newborn screening started in the United States in the early 60s, and in the next couple of decades, it spread around the world. But in the Philippines, it was only introduced in 1996 by 24 hospitals in Metro Manila, led by 9 individuals. We called ourselves the Newborn Screening Study Group, and the project was called the Philippine Newborn Screening Project. We had one aim, and that was to gather data to give to government so that government can adopt it on a national scale. And in 1996, everything was done in the spirit of volunteerism. What were we aiming to achieve with this pilot project? If in 1996 we had 24 hospitals, our goal was to have a national program wherein all the hospitals and the birthing centers in the country will be offering newborn screening to the babies. The Philippines is an archipelago. It has 7,600 islands. And at the end of 2021, 26 years later, we are offering newborn screening in 7,400 hospitals and birthing centers to every baby born in that hospital. We are now screening for, every baby now is being screened for 29 conditions included in the panel. So how did we get to this point? One major strategy was legislation. In 2004, we had a newborn screening law, the Newborn Screening Act of 2004, or Republic Act 9288, which provided guidance for the governance and framework for implementation. It defined that the Department of Health was the lead agency despite a devolved health system. Newborn screening was included in the benefits package of the newborn. In other words, it's covered by insurance. The academe provided a technical partner, the Newborn Screening Reference Center, and the partnership is with the Department of Health in the implementation of the program. The responsibility for informing the parents fell on the health workers. So in other words, midwives, nurses, doctors were in charge of telling the parents that newborn screening must be given to the baby. And to make sure that all hospitals and birthing facilities offer newborn screening, the DOH and the Philippine Health Insurance Corporation included newborn screening as one of the requirements for licensure and accreditation. So the question is now, is the law enough? The answer is no. We need the people. We need an empowered community from all sectors. The staff, midwives, support staff at the labs, those receiving the samples, medtechs, nurses, doctors, specialists, we need them. On the ground, we need program partners and advocates. The local government units during the Newborn Screening Week do their campaign. The private companies include newborn screening in their baby and family expo. Many volunteers have gone to the radio station to talk about newborn screening. We have youth leaders who campaign newborn screening at the colleges and the universities. We now have Save Babies who offer testimonials. And of course, we have parents and their guardians who also come forward with their stories. We have engaged the academe and the civil society, deans of nursing schools, deans of medical schools, the midwifery groups, the professional societies. Everybody must be on board. And by engaging the deans, we ensure that the next generation of health professionals will understand the benefit of newborn screening. In as much as we're screening for 29 conditions, we need the expert panels to cover the groups of disorders. We have a panel for metabolic disorders, a panel for G6PD deficiency, thalassemia, congenital hypothyroidism, congenital adrenal hyperplasia, and cystic fibrosis. And the expert panels provide the algorithms for screening, the protocols for confirmation and treatment, the answers to the frequently asked questions of the doctors and the patients. And you can see that during the pandemic, nobody could stop this group. They met by Zoom to be able to continue providing service to our patients. In the digital age, we have to use it for continuing education to ensure that the success is sustained. For the general public, we have the website, and for our health professionals, we have actually are about to launch a mobile app which has bite-sized facts. It has reminders for participants in compliance for requirements. We have a reward system for compliance, and using this app, we are able to track down the performance of the hospitals and the birthing facilities. At the end, the best person to be able to sell the program is a patient who has been saved by newborn screening. Let's meet Daniela.
Isa po ako dun sa mga
Daniela said, I am one of
bata
the
na
lucky newborns saved by newborn
Kasi kung
screening.
hindi po dahil
Newborn
sa
screening
napa-newborn
saved me
screening ako,
from the
hindi
complications
po
of the non-treatment
maaagapan po
of
yung,
congenital
mga pwede pong maging
hypothyroidism.
simptomas ng kondisyon po na congenital hypothyroidism. Kung hindi daw po naagapan
According to her mother, if she was not saved by newborn screening, she will be mentally retarded. For example, at the age of 10 years old, she may have the mental age of 1 year old. And luckily, she was saved by newborn screening.
Thankful po ako na napa-newborn screening
Daniela
po ako
said, I'm very
kasi
thankful
hindi naman
that I
po
was
dahil
screened at birth,
doon.
because if not for newborn
Siguro
screening,
po, ngayon,
I will
wala
not
po
be
ako
here.
Ngayon dito, ganun. Tapos
And
hindi
I
ko
will
po
not be
na-enjoy kung
enjoying
ano po yung mga
life.
dapat ko po ma-enjoy, hindi ko po na-experience yung mga na-experience ko ngayon. Isa po ako dun sa
So
mga
Daniela
maswerteng
is just
bata
completed
na
a
napa-newborn
degree in political
screening.
science.
Kasi
She is
kung
now
hindi po
working
dahil
in
sa
a law
napa-newborn
firm, and she plans to take up law. So what has been our experience and learnings as we develop this initiative? Newborn screening needs a whole of society and whole of government approach. It must be included in the priority of the government. There must be full or partial government financing. Public education must be planned and continuous. Acceptance is critical for success. All health practitioners must cooperate and must be involved. And when I say that government must be involved, it means that they must participate in the institutionalization of the program, in the implementation of newborn screening down to the smallest community. So what has been the impact to us in our healthcare system? And what do we expect beyond? Well, right now we have an organized system for education, screening, recalling, and treatment of cases. At the end of 2021, and that was pre-pandemic, pre-COVID, the screening coverage was 92% of a newborn population of about 1.8 to 2 million. During the COVID lockdowns, coverage went down only to 80%. And this proves that even if we are archipelago, even if we have thousands of islands, we can survive during disasters and lockdowns. And now we are screening for 29 conditions with the inclusion of rare diseases in the newborn screening panel. So what is my final message? Everything is possible if we work together. Thank you for the opportunity to be part of this program, and I'll be more than happy to answer questions.